I'm Sarah Swallow, and I am the Media Liaison Public Information Officer for the Delta Police Department. And I'd like to welcome you all to North Delta Secondary School and really thank you for being here and taking time out of your evening, taking time out of your week, and coming here to join us for this, which is the second of our two fentanyl forums, which we're co-hosting with the Corporation of Delta and the Delta School District. We are starting just a little bit late, so we will do our best to keep everything on track, but we may finish maybe about 10 minutes later than we originally anticipated. So we decided to host these forums in response to the growing concern about fentanyl and the recent overdoses in Delta and around Metro Vancouver. And we wanted to have an opportunity to meet with you, our community, to have an open dialogue. The speakers tonight are going to discuss a range of topics which include what fentanyl is, why it's dangerous, how prevalent it is, and how it can impact even a casual user and their families. So we hope that what you'll leave here tonight with is a better understanding of what the drug is and its effects, and some strategies for talking to family. These forums are an open conversation, and so in order to provide you with an opportunity to ask questions, we have several methods for you to do that. So if you have kids with you, you can tweet us, and we are a handle at Delta Police. You can text your questions to the number on the screen there, 778-928-0793, or you can just put your hand up and we'll have somebody roaming around with a microphone so you can ask your question. It's all anonymous if you want, so if you have a question and you just want to write it down and hand it to the person with the microphone, we can get that question asked, no problem. We will gather up questions that are fairly similar and answer them because we obviously can't answer all the questions this evening. And then once we're done, we're committed to providing... Oh, someone's got to go to an emergency. There we go, fire's off. So we will gather these questions together, and we have a commitment to you that what we will do is we will post these presentations online on our website at deltapolice.ca, and in the coming weeks we will gather all the questions, and there are tons of them and they're all really, really good questions. We will gather them together and we will have answers on our website and resources. So some of you, if you text us tonight, you may get a tweet that it's or you may get a response that's a little bit general, but we'll make sure that we answer that question one way or another. First off, I would like to call Mayor Lois Jackson to the stage for opening remarks. There she is. There we go. Got all kinds of things here. Okay. Well, good evening, ladies and gentlemen, and boys and girls. Thank you, everyone, for being here tonight. Even with our very busy schedules getting into the fall season, we are all taking the time to be here to talk to as many people as possible and discuss a serious and deadly problem in our community. As you are no doubt aware, our first responders recently dealt with a very serious drug overdose issue in the neighborhoods of South Delta. 9 young people in our community overdosed in a matter of 20 minutes on what our Delta police believe to be cocaine laced with fentanyl. Unfortunately, since then, there has been a fatal overdose in North Delta, and my thoughts, and I know your prayers, go out to the family and friends of that young person. I feel frustrated, ladies and gentlemen. I'm frustrated and I'm angry. How many times have we repeated ourselves over and over again about the perils of drug use? Schools and police are constantly working
to educate our youth. But for some reason, the message is just not getting across to some. So what is the reason that our educational message isn't working? Any ideas? I want you to think about that. This drug abuse issue is not about drug addicts in the downtown east side, ladies and gentlemen. It is about recreational drug users in our community. Those people who use drugs occasionally think there is no harm or risk. They think drugs can't hurt them. Let me repeat, it's about recreational drug users. But just wait a second here, just wait a minute. You know, I hate that term, recreational drug users. You bet. And why? Because to the young people, recreation means fun. It means swimming and biking and watching movies and rock climbing. Yes, recreation is fun. No danger there. But, ladies and gentlemen, drugs are not meant for fun. Drugs are to be used for sick people with terrible diseases like cancer and heart disease. People who use drugs are sick people who require drugs to make them well. When we use the words recreation and drugs together, there is a connotation that it's for fun, it's for recreation. What kind of a message is that for our young people? But I am here, and others on the podium are all here tonight to tell you again, unless you need to take drugs for an illness, taking drugs can ruin your life and many other lives that you love. As we have tragically learned recently, these drugs can kill you. You know, the drug dealers that work in our community, they don't care about you. They are willing to exchange your lives for a quick and dirty buck. You think they are your friends and you can trust them? Wrong. They don't care or worry about the dangerous additives that they use to create a cheaper product. It's a business to them. Follow the money, ladies and gentlemen. Follow the money. About a month ago, Delta Police was responsible for one of the biggest fentanyl seizures ever in British Columbia. And while our dedicated Delta police officer, under the great leadership of Chief Neil Dubord, they work so hard to keep drugs and drug dealers off our streets. But they can't do it without our help. They can't act unless they have the information that they need to keep these low-life drug dealers off our streets in Delta. And I challenge you all, if you know something that will get these drugs and these dealers out of our schools, off our streets, and away from our children, call the Delta Police. Tell your parents, tell the teachers, tell your pastor. Call me, for goodness sakes. The police can't do it all. The Delta School District can't do it all, and I can't do it all. But we are all here to help you help you. And only by working together can we make a difference. And I'll say this as loudly as I can. Drug dealers are not welcome here in Delta. They are not welcome in our schools or on our streets or in our homes. They are harbingers of despair and troubled people, sorrowful lives and broken families. But there is hope for those who realize how simple and easy it is to just say no. Do not be seduced by so-called friends who want you to just try it. Do not be seduced into thinking you are one of the cool kids because you do drugs, any kind of drugs. Do you know that drug overdoses now kill more Canadians than car crashes in Canada? And that approximately 2 people die every single day in BC. 2 people every single day in BC from accidental overdoses. 62% of those are linked with fentanyl. Now, don't just think because we're focusing on fentanyl that there is no other problem with drugs or gateway drugs. I wonder if Jane is in the house. Now, ladies and gentlemen, here in North Delta, you might not have heard of Jane. It's an anonymous name. She was very brave in telling her family story and the history of her 2 children in the Delta Optimist newspaper this week. And if Jane has come here from South Delta, I want to salute you. Keep telling your story. You may just save the lives of children and other families from the tragedy that you have experienced. In closing, I want to quote from the article which Jane spoke of her daughter, and she says, "She loved marijuana, and that's how the drugs started." Can I repeat that, everybody? She loved marijuana, and that's how the drugs started. She goes on to say, but when she goes off the rails, she turns to cocaine. She realizes that if she doesn't stop using cocaine, she will probably end up dead. South Delta family. She said, everyone has to play a part in helping to get these drugs off our streets. If we don't stand up, nothing is going to change. Our kids are going to keep dying. End of quote. A very sobering message. Ladies and gentlemen, last night we had a lot of questions about naloxone and whether our police officers should carry it. And as you know, our Delta Fire personnel, our first responders, they do carry kits in all the trucks. They are all trained to administer naloxone, but our Delta police are not. And sometimes they are to the scene first. And if there's an overdose, seconds count. So today, at our monthly Delta Police Board meeting, which I chair, we discussed this issue, and our police chief, Neil Dubourg, and his senior management have the support of the Delta Police Board to undertake the research and the potential implementation of our police officers carrying naloxone. And if our chief sees fit, we will ensure that our police officers, along with our first responder firefighters, have the tools they need to keep the public and themselves safe. Now, ladies and gentlemen, thank you. Tonight, you will hear from a Delta Police drug expert, and it is my hope that we learn some additional information which will help protect us and our children and our grandchildren and our community from getting involved with drugs in the first place. So, ladies and gentlemen, boys and girls, may I leave you with a few final words. 1, do not accept the temptation by your cool friends that it's okay to just try it. It's not okay, and it is not cool.
From local experts about fentanyl and the very real concerns we have about its increasing prevalence in our community, the dangers surrounding its potency, and how easily it can go undetected. This is a frightening subject. However, I hope that tonight we'll be able to answer some of your questions and offer you some tools and resources for talking with your children. I'm here tonight as superintendent, but I'm a father in this community. I have 3 boys, and I know it is a challenge for parents to have those discussions with your children. So I applaud those parents who are here tonight trying to get more information. I'm getting more information. It's been 6 years since I was a principal of a high school, and in that time, I had no idea. Fentanyl was not a word that we used. It was not a drug we had any knowledge of at that time. It has exploded in terms of the amount of information and how quickly it has come into our communities. So I appreciate you coming and seeking that information tonight. At the Delta School District, we've been working closely with Delta Police experts, our school liaison officers, officials at Fraser Health, and other community organizations, some of who are here this evening to learn as much as we can about fentanyl. I'm here to learn alongside of you. The safety of your children and our students is our primary concern. We will be bringing this information to our classrooms, and sometimes that's an incredible blessing, because the relationships that our dedicated staff, our counselors, our youth and child and care workers have with your sons and daughters is sometimes the best place that we can have that adult to youth connection so that they can get the information they need to hear from a trusted source. The more students understand and are aware of the unique dangers inherent to fentanyl, the more likely they are to make smart decisions and keep themselves and their friends safe. Tonight is important, but it's only the start of this conversation. As we journey through the school year, we will continue to speak with students and maintain an open and honest dialogue on this topic. The information we learn tonight needs to be repeated and shared. If after tonight you have more questions, please reach out. The police will have more information on their website. We will maintain some information on our website, and I know Fraser Health has already posted a number of fabulous resources for parents and community members. Delta Police will be keeping a webpage, and at our schools, counseling staff, administrators, and our child and youth care workers are there to help. They can answer questions or help connect you with the local experts and resources you may need. This is a difficult and complex issue, and I'd like to thank and applaud Chief Dubord and the Delta Police Department for their support and knowledge as we work together to keep our youth in this community as safe as possible. Thank you again for coming out.
Thank you, Superintendent Shepherd. We'll now move on to our first presentation by Delta Police Sergeant Dave Von Smith. Sergeant Von Smith is a drug expert with the Delta Police, and he'll be talking to you a little bit about fentanyl today.
Good evening, everybody. My name is Dave Von Smith again with Delta Police. I was with our drug section for 6 years and currently been with our street crime unit for the last 2. Just to give you an idea on how new this fentanyl is to us, or how it's increased to us as of recently. When I was leaving drug section, we'd barely seen any fentanyl, and I left in 2014. 2013, I believe, was our first seizure that we'd seen in Delta Police, and it was a very small amount. Fast forward to today, and we're seeing it almost on most of our drug seizures involving any street-level heroin. It's most of it on the street right now that we're finding is testing positive for fentanyl. So tonight's presentation is just to provide you with a brief rundown on what fentanyl is, why it's so dangerous, where we're finding it at the police level, and hopefully to share some knowledge with you guys. And I noticed that there is a lot of youth in the audience tonight, which is great to see, and hopefully for those people who aren't here tonight, they can hear it from those who are, and you guys can help spread the message. So fentanyl is, what it is it's a powerful synthetic opiate. So it's 100 times more powerful than morphine, which is used in hospitals. So if you can imagine that morphine is known as a powerful drug for pain management. Many people have been prescribed morphine for pain management as well, and they know how powerful it is. Fentanyl is used in hospitals and continues to be used today for pain management. When used under a doctor's care or guidance of health professionals, it can be used safely for long-term pain management, and it still is used. So The problem with fentanyl is it's being abused and being introduced into street drugs. The effects of the street drugs that do contain fentanyl cause a lot of issues because it is so unpredictable. It is such a pure toxic substance that it doesn't take much to do damage. It doesn't take much fentanyl added to a bit of heroin to cause an overdose. It doesn't take much for a bit of fentanyl to be exposed to another street drug like cocaine to cause an overdose. So unfortunately, users and the sellers who are selling it, they have no idea of the level of purity when they're taking the drug or selling it. The problem is in the manufacturing at the street level is because fentanyl is so pure and such a small amount is used in the making of street level drugs that if they get their recipes wrong or are negligent in the way they mix it, you can have a batch that is much stronger than the next. So to put it in perspective, 2 milligrams, which is equivalent to a couple grains of salt, is enough to cause an overdose on any first-time user. Where we're seeing fentanyl right now, primarily in heroin and oxycodone on the street. Heroin over the last couple of years has all been almost replaced, it seems, with fentanyl-based heroin, or we call it counterfeit heroin. So everyone knows that heroin can do enough damage on its own, but now it's being replaced with fentanyl and sold as heroin still. So we are finding that fentanyl is being used as the active ingredient in heroin. So the street user ordering up heroin is likely getting fentanyl in this day and age right now, or a mix of the two. Oxycodone is another one that we're seeing on the street. We're calling it counterfeit oxycodone. It may look identical to some pills that you get in a pharmacy or prescribed by a doctor, but unfortunately, if they're not prescribed by a doctor and they don't come from a pharmacy, there's no way of telling what's in them. To give an example, that picture of is oxycodone. That's counterfeit oxycodone, but it looks identical to an old product that used to be sold in pharmacies that is no longer called CDN 80s. And these are made in makeshift drug labs with pill presses by not scientists, not chemists, not pharmacists. These are made by people on the street. They're made by drug dealers and pressed into pills to look like the real deal. Unfortunately, you have no idea what you're getting when you order these pills on the street. There's no quality control in these drug labs. What you get is a mystery, and when you take it is also a mystery. All it takes is one bad batch, and that could cause an overdose. Cocaine is something we've also been finding it lately, increasing. We're not quite sure the reason behind fentanyl being introduced into cocaine, but we do know that a lot of these drug labs are producing mass amounts of heroin, mass amounts of cocaine, and fentanyl is present at these labs as well. And sometimes they're using the same area to mix their drugs, cook their drugs, same containers. One could have heroin in it, one could have cocaine in it, one could have fentanyl in it, and being that fentanyl is so toxic, it only takes a little bit to mix in with some of the cocaine, and that could also cause overdose effects. So when someone is taking cocaine, again, depending on where it's produced or where it's coming from, there's that chance of cross-contamination, or the person who's selling the cocaine didn't mix it properly and added some fentanyl accidentally, and we are seeing an increase in that for sure. And the 9 overdoses that the mayor spoke about earlier that occurred in Tsawwassen at the beginning of the month, those were all young adults who thought they were using cocaine at the time. And when we tested the substance seized at one of the scenes, it tested positive for cocaine and fentanyl. Marijuana is another topic that's come up a lot lately. Wondering if fentanyl is in this marijuana or if people are lacing it with marijuana. Our theory on this is that it doesn't really make sense for fentanyl to be in marijuana. However, again, similar to cocaine, it all depends on where this marijuana is being packaged. If it's close to any other products carrying fentanyl, if it's in some of these stash houses or cookhouses where fentanyl is being produced in cocaine or heroin, there's also a risk of it cross-contaminating into marijuana. In the Delta Police, we haven't seized any marijuana that has had fentanyl in it, but it is a risk out there. Again, when you're buying drugs on the street level, you got to remember that there's no quality control. It's street-level drugs being produced by uneducated drug dealers, not scientists, and there's always a risk on buying any drugs on the street. Just back to prescription drugs, in particular oxycodone. They're being sold on the street and abused on the street right now. They go by several different names: Oxy, Green Monsters, Green Goblins, Green Beans. Again, they look like prescription pills prescribed by a pharmacy. And unfortunately, what we found is that kind of the stigma of using drugs is gone when people think they're taking a prescription drug, because if it's a prescription drug, maybe it's safer. What we're seeing on the street right now, again, is the counterfeit oxycodone pills. So again, unless it's being prescribed from a pharmacy, there is no quality control, and we don't know what it is. And I'd say probably the majority of the oxy out there right now is counterfeit, especially the CDN 80s, and what we're finding is they're all produced with fentanyl as the active ingredient. Again, prescription drugs from a pharmacy can also be abused as well. Again, it's important to make sure your prescription drugs are well protected, out of reach of children, and know where they're going as well. Xanax or Xanibars or bars is also a drug that we've seen lately that's seemed to be becoming more popular with young people. We're also seeing counterfeit Xanax on the street. And again, same as the oxy pills, we don't know where this is being produced. And chances are, if they're producing Xanax in an illicit drug lab, that they're producing other drugs as well. And the risk of a negligent mixing and bad batches or cross-contamination is there with those as well. This is just a quick chart to show the fentanyl deaths in BC since 2012. As you can see, the steady incline on those, and we can tell you, we know for sure, and I think Dr. King will speak on it during her speech, is that 2016 it's going to be well above what we saw in 2015. So how do we protect our youth in our communities? This is the first step in obviously educating people, spreading the word amongst our young people, and knowing that if you use drugs once, if you're a casual user or thinking about doing it, in this day and age, it only takes one time. And as we saw in Tsawwassen a couple weeks ago, that could be your last time. Fentanyl is that. It's not forgiving at all. It's that dangerous. The small amount is all it takes for an overdose to occur. And again, like I said, 2 milligrams of salt isn't much. And if that 2 milligrams of salt is in presence of any of the street drugs that you're taking, that obviously could cause an overdose. Talk to your kids openly. Make sure they know what fentanyl is and the dangers. And hopefully, nights like tonight help with that. Know what they're doing, know who they're with, and obviously if you know someone who's using drugs casually or thinking about using drugs casually, in this day and age is probably now the time to stop or not do it at all, as the risk is there. Like we said, only one bad pill can cause death. So we're going to have time at the end to answer a lot of questions. I'm sure there will be some that'll come up. I know last night we had quite a few, so we'll save that for the end.
Our next presenters are Dr. Arlene King, the Executive Medical Director for Fraser Health, and Mark Goheen, who's the Clinical Specialist, Mental Health and Substance Use Services. And just a note on the questions again, if you can text your questions or tweet your questions. We've got a couple coming in, but you can do that at any time. And when we invite all the speakers back on stage for the panel, we'll make sure we cover those questions and any new ones that come in.
as has been mentioned earlier, and the increase in overdose deaths in the province of British Columbia prompted the provincial health officer, Dr. Perry Kendall, who's shown in this picture, to declare a public health emergency in April of this year. This is a graph of the increasing trends in overdose deaths over a number of years. This is actually since 1989, and you'll see there have been peaks and troughs. But according to the BC Coroner's Office, as of July 31st, there were 433 apparent illicit overdose deaths this year so far, and that is a 74% increase over the number of deaths occurring during the same period last year. And as the mayor said, that works out so far to 2 per day in the province. 20 to 40-year-olds accounted for 54% of these deaths, and 11 deaths in 2015, and so far to date in 2016 have been in the 10 to 19-year-old age group. No age group is immune. Males account for 80% of these deaths, and the top 3 townships in British Columbia are Surrey, Vancouver, and Victoria. To date, of those 433 deaths this year, 155 have occurred within the Fraser Health Authority. Next slide. This is a distribution of illicit drug overdose deaths in Fraser Health in each of the local health authorities, and you'll see that Delta is in from the 5th from the left. And there also is, as you can see, a great deal of variability in terms of deaths over the last 6 years within the Fraser Health Authority. And although Delta hasn't been impacted as much as some of the other areas, local health authorities of Fraser Health, the rates in fact have gone up progressively between 2010 to 2016. Next slide. And again, as has been mentioned earlier, this fentanyl issue and the contamination of street drugs with fentanyl was not an issue a number of years ago, and so far this year, and this data is not complete yet, 62% of the illicit drug deaths that have occurred have been found to have had fentanyl within those inquiries and those death inquiries done by the coroner's office. So what's my key message here? If overdose deaths continue at their current rate, there will be 266 deaths in the Fraser Health Authority in 2016, which is a 32% increase over 2015 and a 100% increase over 2014. Drugs also do not discriminate. All kinds of users are at risk due to fentanyl. Those who experiment, those who use them occasionally, those who are problem users, and those who are dependent. Overdose deaths affect everyone. Individuals, families, friends, society, mothers, fathers, children, brothers, and sisters. So what's the key message here? Overdose and deaths can occur in any person who uses substances, even those who only experiment or who use occasionally. Any drugs bought on the street can be contaminated. So Fraser Health has been working for quite some time to enhance our response to this overdose crisis that we're experiencing in British Columbia and within our local health authority. We have 9 parts to our strategy, and I'm going to only elaborate, because of time, on 3 of those. The first part being working with community partners on overdose prevention, recognition, and response. Although just to skim over some of the other elements of our response, it includes improving or enhancing our surveillance or monitoring and utilization of the data that we have on opioid overdoses, including monitoring our emergency room visits. Encouraging safe prescribing practices has recently been released by the College of Physicians and Surgeons of British Columbia. I'm going to talk a little bit about increasing overdose awareness and education. Next slide. We're enhancing harm reduction services, increasing access to opioid substitution therapy, exploring potential sites for supervised consumption. I'm going to talk a little bit about improving access to naloxone, and then finally, we are working on enhancing substance use services and supports. And to repeat, I will only talk about 3 elements, key elements of our response. But the key message here is that our response in Fraser is multi-pronged, and it aims to raise awareness about overdose prevention, recognition of an overdose, the response to it, enhancing our harm reduction services, and advancing our substance use services and supports. So with respect to our first strategy, we are working closely with our community partners here in Delta as allocated, and many others. There are many other organizations, community-based organizations, that are also here who have information related to the services that they offer. And yesterday, we released a new digital information kit for schools and parents. And I believe we may have some copies outside at our resource table. Regardless, we do have the link, web link, and it's all on, again, paper outside that you can take home. You can go home and look at the website yourself. You will find facts on fentanyl, on overdoses, and on naloxone, how to talk to youth about drug use, how to talk so kids will listen, and listen so kids will talk to you. How to support students who may have experienced trauma as a result of exposure to overdoses, or may find the information that we're talking about today disturbing as well. There's a social media toolkit, poster, brochures, videos, and other online resources and supports. This is one element of that, and it allows you to go in and get answers to many of the questions that you probably have. You can zoom in on each of these areas, and it's just an example of some of the information that is available there. And I want to talk specifically about this issue of talking to and with youth. From a 2013 BC Adolescent Health Survey of 30,000 youth, we found a correlation between a reduced use of substances in youth and the presence of a supportive relationship with adults, teachers, family members, and other professionals. Schools can and do contribute to essential protective factors for substance misuse that lead to overdoses. Next slide. Another element of our response is increasing overdose awareness and education. And I want to specifically, next slide, refer to a poster and a pamphlet that we have available outside, which really describe the signs. This is part of the early awareness and detection of overdoses, the signs of an opioid overdose. And it will help you if you want to learn how to spot an overdose and what to do about it. And again, one of the hallmark characteristics of an overdose of an opioid is slow or absent breathing, or not being able to wake somebody up. Next slide. We're also working hard at stigma reduction, and many of you will recognize this fellow. It's Matthew Perry. And he said that a lot of people think that addiction is a choice. A lot of people think it's a matter of will. That hasn't been my experience. I don't find it has anything to do with strength. So my key message here is that public confusion, misinformation, and the stigma of addiction stop many people from getting help. Finally, in terms of one of the elements of our response, I want to talk about our take-home naloxone program. And this is the kit, and we have some examples outside of take-home naloxone. This is a program that is administered by the BC Centre for Disease Control in Vancouver, but it is a provincial program. So next slide. So you probably want to know what naloxone is. It's also referred to in its brand name, which is Narcan. It is a life-saving medication. It temporarily reverses slowed breathing from too much opioids. So it's not just for fentanyl. It's used for morphine overdoses, codeine overdoses, all of that class or that family of drugs. It does not work, however, for non-opioid overdoses. So overdoses due to alcohol, cocaine, crystal meth, a number of other drugs. But it can help if, in fact, there are multiple substances involved, of which opioids are a component of those drugs. So what is naloxone? It's the only injectable naloxone is approved for Canada, although intranasal in the nose, naloxone is in fact being trialed in some places. It's very safe. It has no effect whatsoever unless someone has overdosed on opioids. There is no potential for abuse, and it does not encourage increased or riskier behavior. And in fact, evidence is shown, and why I'm thrilled that both Delta Fire and Delta Police are now looking at I know Fire is administering, Delta Police are also looking at administering, is that evidence has shown that communities with greater access to naloxone overdose training and to naloxone distribution programs have half of the overdose deaths and the death rate compared to those communities with less access. So here's what's inside the kit. A whole lot of different things, as well as drugs, syringes, gloves, a breathing mask, because if you find somebody that you suspect has overdosed who isn't breathing, you need to administer mouth to mouth. And one breath every 5 seconds to try to keep that person alive until 911 assistance can be obtained. So we're working hard, although we haven't got as much out there as we'd like, and we really rely on our partners to help us with this too, is we have increased the number of sites where naloxone is available through Fraser Health, in addition to the ones that are being administered by our first responders. So we now, as of July 31st, have 39 sites providing these kits. We've dispensed a lot of kits in 2016, a lot more than last year. And I'm pleased to say that all 12 of our emergency departments are registered to dispense take-home naloxone kits. However, there's also another option, which is pharmacies, and naloxone is now available without a prescription in British Columbia. It's available over the counter. No restrictions on purchases, and pharmacists provide the education. The next slide and the final slide for my segment of this presentation from Fraser Health is just a list of some resources. And again, we have this sheet outside. These are some of your local resources, as well as that website to Fraser Health, to this information for schools and parents available outside at the table, at the Fraser Health table. So thank you for your attention. I'm going to hand the next part and the final part of this presentation to Mark Goheen. Thank you.
When I was driving over here tonight, I was trying to think about some things that would be important to talk about. So I think as people are picking up, there's different layers to this conversation. So one layer, what is fentanyl? What's the facts? What's the hype? What's reality? Tonight, the police and Dr. King have done a great job of trying to sort through some of the myths and some of the truths about fentanyl. And I'm always concerned about, especially young people, walking away thinking that there's a bunch of scare tactics or hype, and hopefully the message is coming out. I think the term we often use now, it is a game changer. When I was in school, we were being told if we ever used drugs, we turn into zombies. And it turned out that wasn't quite what would happen. So, but what's different about fentanyl, I think, as people are picking up, when this idea that drugs will kill you, is that the numbers speak for themselves. So just one of the ideas that if people are concerned about hype and whether this is all real or not, really encourage young people to I just want to respect the fact that we all have our own opinions, their own ideas. It's important for people to connect with their own truth. The other idea I just want to share, and just put out, especially for younger people that joined here tonight, I'm just absolutely, it's incredible that the turnout has been so big. It shows that there's a tremendous amount of concern, but there's almost a tremendous amount of caring. One of the ideas about us being here tonight, and I don't know if this makes sense to young people, but us being here tonight is an act of love. This is not coming out of anger. This is not coming out of people wanting to get people in trouble. This is coming out of a deep concern. And the message that we really want to keep putting out there is that, is that each person in our community is sacred, and that message needs to get out there again and again. So there's a lot of interest about why would anyone use drugs, and I just want to shift that just very quickly, because the truth of the matter is that the overwhelming majority of people in our society do not abuse drugs and are able to negotiate adolescence and grow up healthy and well and live the potential that they have. So there's another area of interest, is that, so what seems to support young people in really respecting themselves and keeping themselves safe and healthy. And Dr. King alluded to it earlier. So I just want to, this is sort of a message for parents and teachers and police and all the other adults who care. I think it's important that we continue to remind ourselves in the face of these fears that being present in the lives of young people is the single most important protective factors, and to never underestimate how important our love is, our concern, and our respect is for young people. So keep those conversations going. It turns out that there's been people who have spent their lives researching this question, and to really kind of boil it down, there's three primary protective factors, and this has implications for parents and for teachers and police. It has implications for everybody. The first is that one of the things that helps people in the game of life is a sense of belonging. So the importance of family, sports teams, friends, activities that go on in the school. So it's important that we continue to ensure that each and every person in our community finds a sense of belonging. The second is opportunities for everyone in our society to contribute, to be part of, to have opportunities, to have a voice, opportunities to create opportunities, to participate in what it means to be a citizen in this world. And the third one is supporting people and helping to find a sense of what matters in this world. And it turns out that you can't tell people they belong. You can't just tell people that what they do is important, and you can't tell people what their values are. It turns out that we have to support young people in discovering those things through actually experiencing. So schools, classrooms, families, interactions are extremely powerful. But if we shift the lens to the issue of fentanyl, the concerns about fentanyl, this is, I think, a message for all of us in our systems of care. It's really important that we pay attention to ensuring that youth are part of the conversation, that they belong as part of the solution. And secondly is that we continue to create opportunities for youth to care for each other and to be the eyes and ears of the solution. And thirdly, around the idea of what matters, it's important that we continue to keep our hearts and minds open so we can hear from youth their own concerns and their own values in this conversation. So there's good reasons for all of us to be afraid, but there's also good reasons for us to be hopeful and trusting that deep inside all of us there's a wisdom and there's a hope to do good things. So keeping those conversations open is really important. And the final piece is sometimes, and I don't want to discredit the media or not, I mean, we do live in a time where there's lots of things to be afraid of, and sometimes I'm concerned that the message is that there's some type of out-of-control epidemic of drug addiction amongst our young people, and the statistics, that's not quite the story. There is some good news here. There is some hope in all of this. that if we look at the very well done scientific surveys both in British Columbia and across many parts of North America, overall drug abuse amongst young people is slowing down, not speeding up. And as Dr. King was suggesting, is that when we sit down and talk to young people and do research and do surveys and really try to understand what that's about, why it is that young people are making healthy decisions and affirming their sacredness as people, it turns out that the single most important factor that keeps showing up is young people talk about the sense of being loved, a sense of belonging, and the importance of relationship they have with families, with friends, with teachers, and with other people in the community. So information and health care and all the other things that we're talking about here tonight, the resources that are out of this building are extremely important. But I just want to keep putting out the message that the resources that we have within ourselves and between each other are probably the most important things that we can bring to the table. Thank you.
Thank you. We will now move on to our panel discussion. So I'd like to call the panel members up to the stage, and we've started to get a bunch of questions in, so I will ask some of those.